Good afternoon, everyone. Welcome to the August Wellness webinar. My name is Kristen Kayla, and I will be the host of the webinar today. I'll be on the line to assist the presenter of the webinar today, and I do have a few housekeeping items to review before we begin. Participants are muted upon entering the webinar to avoid any background noise. Next slide, please. And if you're having any technical difficulties, please feel free to chat directly to me. And to open that chat box, please hover over the Zoom toolbox on your screen. You'll see a chat box icon there. Simply just click on that icon and it should appear. I will receive your messages in real time, and I'll try to respond to your message in the order that I receive them. So if you have any questions or comments, please feel free to chat directly to me. Next slide, please. Okay, great, thank you. Today's topic is strategies to improve chronic pain management and prevent opioid misuse, overdose. Next slide, please. So before we begin the presentation, I would like to read this disclaimer to you. The information provided in this presentation is intended solely for the general information of the audience. It is not medical advice and shall not replace consultation with your physician or other qualified health provider. If you have any health-related questions or problems, please seek the advice of your physician or other qualified health provider. Next slide, please. All right, the presenter for today's webinar is Niket, a clinical pharmacist at HealthNet. Thank you so much for your time today, Niket. You may begin your presentation.
Sounds good. Thank you, Kristen. I appreciate the introduction. You got me ready to go for this. So for today, we're going to be discussing a couple of things in regards to pain management. Ideally, we want to describe, what is pain? What are our treatment goals for it? How do we kind of approach it? There's multiple ways when it comes to pain management. So we want to go ahead and discuss what are different options, and sometimes it might be even a combined option. And we also want to talk to you all about how a patient-centered approach is more likely to lead to better outcomes for pain management. So you're wondering, why is this important? So chronic pain is it's an issue that people have across the entire country. It's probably, a really common complaint that you may hear from your family members, from some of your friends on almost a daily basis. And, some statistics show that, 100 million Americans live with chronic pain. And it can be caused by a different variety of reasons, different types of health conditions that can cause this. So it's definitely a nationwide problem. And to top it off, it's actually even a growing problem. So there's higher prevalence in women. The older you get, I'm sure you've noticed, the more things hurt. People that live, far away from the cities, and adults, living in poverty, and also not in the slide, but also people that have jobs that, require a lot of strenuous work, that can also lead to chronic pain. According to CDC, Americans consume 80% of opioid painkillers, around the world. So that's an issue that we want to address, and I'll be going over that later on. But I'm sure everyone here has already heard about this, opioid crisis. People are using it, or I should say misusing it to an extent where it's become a national problem. This number may even be quite low, but over 16,000 die every year from opioid overdose, and that's just the ones that are reported. I'm sure you guys know there are many others that just don't get reported. So I wouldn't say 16,000 would be the lowest reported number of opioid overdoses, in the country. So let's start off with the basics. What is pain? So pain usually occurs when you have nerve endings, all around your body, all the way from the top of your head, all the way down to your toes. And these nerve endings, what they do is when they experience pain, they send signals all the way to the spinal cord and basically send it to your brain saying, hey, this area, you're experiencing pain, essentially. And so it's basically a messaging system from your body all the way up to your brain. And so your nerves, spine, and brain constantly message each other to determine how you experience the pain as well. The severity of it is the main issue. Does it hurt a little bit? Does it hurt a lot? What kind of pain are you experiencing? Compared to like something that stings, something that burns. All sorts of different types of messages are being relayed. In terms of how your brain receives it, the main one is your cerebral cortex. It basically says, okay, we have pain. What do we do about it? If your hand is over a fire, your brain's gonna be like, remove your hand. Your limbic system responds with emotion. Like you're obviously gonna feel, some examples where you're gonna feel is anger, fear, frustration. And when you remove yourself from that pain situation, you're gonna feel relief. And then your brainstem controls the automatic functions, like breathing, heart rate, that can change to response in pain. So if you're in continuous pain, what could happen is that, if you're experiencing chronic pain, you may have issues which can affect the rest of your body. And we'll get into that as we go further into this presentation, but it's something to keep in mind. Your brain is acting on this pain signals, and it's basically trying to help you get through it. Okay, so there are multiple types of pain. Acute pain is similar to the ones where I described earlier. You put your hand over your fire and you remove it. That's basically acute pain. That's kind of just short, temporary, and it goes away. Chronic or persistent pain is ones that, pop up on a more regular basis. Common complaints would be like, oh, I have back pain, or, oh, I have pain in my side, that from every day waking up and stuff like that. So those are the ones that you kind of experience on a more regular basis. There's all sorts of other ones, such as central pain syndrome. That's one where you experience pain all over. That's usually a rare issue, but it is still one that can occur, especially for those members who are diagnosed with cancer. They're taking the medications associated with cancer that can also create pain. That's kind of just all over the body. And then continuous pain versus flare-up pain. So I'm sure flare-up pain, if you ever experience gout, or if you experience people, who talk about, certain things that kind of just initially just happen here and there, like, oh, this flares up, when I bend over a certain way, or if I eat something, it starts to flare up. So flare-up is more of like, can happen, certain triggers can cause the pain to come up. Whereas continuous pain is no matter what you do, no matter what happens, every day you're going to experience something. So these are just some common complaints that, you may experience, or you probably hear your friends or family talk about. Things that, are common, symptoms, are like when you go to your doctor and you explain, like, what's going on, like, why are you in pain? Certain things like, oh, I'm experiencing, stabbing pain, or, oh, I'm experiencing things where when I think about the pain, it gets worse. And then that can also lead to, behavioral health issues. You may start to feel more anxious or depressed, that your pain is like kind of consuming your life, and all you can think about is pain. That's something that, you would talk to your doctor about, so that they can address it, and so that they can kind of help you and get you the proper treatment. You may also feel symptoms that spread from one area to another area. And so that's one where we need to address it, so that you don't have it where, oh, my back pain has led to leg pain, or like vice versa. So it's one where you have to kind of describe to your doctor, and when you go to them, about, what kind of pain are you experiencing, what makes it better or worse, stuff like that, that kind of helps guide them in giving you the proper treatment. You may also feel fatigued, tired. The pain may be restricting you from doing normal activities, whatever you prefer to do, like on a regular basis, whether it's, gardening in the house, or like, obviously not in the house, outside the house, or like just normal house activities, or going out, doing physical activities. So pain can be an extreme obstacle from your normal lifestyle. And so that's one reason why we want to make sure we address it properly, make sure to get you proper treatment, so that you can continue to live your life without having to deal with this. So when it comes to pain, it's a very vicious cycle, because one thing leads to another, and it kind of just contributes all the way around. You may experience persistent pain, which leads to, being less active. And then when you're less active, you're going to lose fitness. You're going to, be more lazy. It can contribute to other chronic, conditions, whether it be obesity, high blood pressure, diabetes. It can be one obstacle, like I said earlier, that can really affect how you are living your normal lifestyle. These are all prime examples of things that pain can cause, which is, lack of energy, tiredness, being stressed out, experiencing anxiety, or if you already have anxiety, it can worsen it. Just normal behavioral emotions such as fear, anger, frustrations. It may affect your outlook on life. You can start having negative thoughts. Like your pain is just like, oh, it's just going to get worse. I don't see any type of relief from this, and it can really affect your day-to-day lifestyle. You may experience depression, mood swings, and then that could lead to other things like your relationship with family, friends, your work, career, and it just really it just snowballs into something that can get worse and worse, and it just exponentiates and gets one where, like, if you don't address your pain, it can just get worse essentially. So looking at it from a healthcare provider standpoint, how we see it, these are the type of goals that we're trying to basically establish for our patients. So like I said earlier, there's two different types. So the first one, acute pain. Essentially, we want to identify, what caused that pain. Make sure we remove it. Make sure that you don't do certain triggers, or basically the underlying cause. We want to make sure we address that. Whether it's a type of injury, like you fell off your bed, or like you slipped and fell somewhere. Just trying to make sure we take care of whatever was hurt and injured, and make sure that we restore function there. Another one is minimize the impact of the pain on recovery. So, say you twisted your ankle, what we're trying to do, make sure you don't walk on that ankle, like we want to make sure that we set perfect timelines for you to recover properly, say like stay off of it for 4 weeks, or give you that was just an example, but give you a proper timeline on what you need to do in order to basically recover and fully heal. We also want to address your pain tolerance. So, if it's something that's hurting every day, or something that's, a constant complaint, we want to make sure that we try to reduce that so that you don't actually feel any pain. Because it's, like I said earlier, if you start feeling pain, it can just lead to worsening symptoms. We also want to take a look at minimizing medication side effects. I'm sure all of you who have ever taken medication know that everything has side effects. So what we want to do is we want to create a personalized plan for our patients, for you guys, that, what can you tolerate, which medications work for you, which ones can cause the least amount of side effects that you feel. And so that's something that, your doctor or your pharmacist can go over and kind of address with you, because the more you know about it, the more likely you are to take the medication treatment plan. And long term, we want to prevent this from transitioning to chronic pain. And because chronic pain is a whole other issue that we want to address and we want to prevent, because that's a more of a longer time frame when it comes to managing and treating it. So when it comes to chronic pain, restoring function is, our main goal. Whatever's broken, whatever's, causing you to, prevent you from doing things, we want to make sure we try to do our best to restore you back to normal, so that you can properly resume your daily activities. Same as acute pain, we want to treat the underlying cause. Pain management is all about trying to find out what is causing that pain. It just doesn't happen sporadically or randomly. There's something that's causing it, triggering it. And so our goal is to identify what that underlying cause is, because once we treat that, the pain will, subside along with the treatment of the underlying cause. For chronic pain, we want to minimize the use of medication. Basically, long-term use of certain medications can cause damage to the body. And so what we want to do is we want to make sure that we use the least amount of medication where you're able to receive proper pain management or pain treatment levels. So we don't want to just keep throwing everything at you and say like, oh, that should fix it. We want to make sure we use the right medications that target what caused your pain and basically keep you on the most minimum type of medication treatment plan. And also the secondary problems, like I referred to earlier in the pain cycle, all the different types of emotions, all the different types of feelings you may have when it comes to chronic pain. And we want to make sure that we address that. We just don't want to treat your pain and be like, okay, you can go out on your way. What we want to do is, make sure that we're addressing all your needs, whether it's like, problem with, getting it up and out of bed every day, whether it's you're experiencing, initial signs of depression, just certain things. We want to make sure that we provide a holistic approach towards you. We just don't want to treat one thing, put a Band-Aid on it, and send you on your way. We want to make sure that you are living a healthier lifestyle. You are, back to where you were before you started experiencing these pain. So one thing that we kind of do, or one thing we usually recommend for our patients, is to kind of help us guide your treatment plan by giving us as much information as possible, because we can't, assess your pain, without you telling us, how does it feel? Like what times of the day would be a great example of like when you're experiencing pain. So that's why having a journal around is extremely helpful. Basically gives us an idea of like, okay, it only happens in the morning and then I feel better. That gives us an idea of like what we can do to kind of help you out. Maybe even say, oh, you only have to take a medication in the morning time. You don't even need it at night. Bringing a list of your medications. This is very important. When it comes as being a pharmacist, there are honestly an infinite amount of drug interactions among medications. So what you want to do is you want to bring an up-to-date list of your medications with you every time you see your doctor, every time you see a specialist. It's extremely important. Make sure you update it. If you stop taking the medication, if you increase the dose, make sure you always keep a list of your medications with you. And it's not just a good, it's a good habit to have, especially, in terms of emergency situations. So always keep a list of your medications with you and bring it to you every time you see a healthcare professional. When it comes back to pain, write down how it affects your life. What is it preventing you from doing? What is it, stopping you from doing? Is it affecting your work? Is it affecting your lifestyle? That just gives us an idea of, how severe the pain is and how much impact it's having, on your lifestyle. Bring questions. There's never enough questions that you can ask to your doctor. If you're ever curious about something, if you ever want to know something about medications, it's a very complex. Medicine is complex. You guys know this. That's why doctors go to school for so many years. But ask questions, because the more you know about your situation, your whatever the current status of your situation, your disease, about medications, the more you know about it, the more willing you are to take the medication, and that's the most important thing. And then also, when it comes to pain, you want to be able to describe it in your own words. So doctors will just be like, hey, what kind of pain are you experiencing? And, just to the best of your ability, try to, describe it. Is it like a stinging pain? Is it a burning sensation? Is it, just heat? Is it, like a stabbing pain? Like try to do your best to describe it, because the different types of feelings you have can really guide us in determining what may be causing the pain. And so that's really important. Don't let the doctor tell you what kind of pain you're experiencing or anything like that. Make sure you describe it how you feel, because that's the most important part. Doctors can't tell you, how your pain is feeling. You have to be the one to tell them, be like, this is exactly how I feel. And then it just gives them a lot more information to work with in creating a treatment plan. So this is a tool that most doctors use. It's essentially just a pain scale. So basically, they will, most of the time you come in, they'll ask you to describe it on a scale of 0 to 10, 0 being no pain at all, 10 being the worst pain you've experienced in your entire life. Where would you describe your current situation at? And basically, when it comes to pain, it's very subjective. There's no test that we can do to be like, oh, hey, you should be here on the scale, or you should be, this should make you lower a couple points on the scale. It's all subjective. So whatever you're feeling, that's basically how we can determine whether our treatment's working or how severe your pain is. So when you're going to the doctors and they ask you this question, try to be as accurate as possible when you describe it, how bad you're feeling, because that gives us a lot of information, and that tells us, is this working? Is it not working? Do we need to try something different when it comes to your treatment plan? So this is just something that we utilize on a regular basis whenever a patient comes in and says, hey, having issues with chronic pain, or I just recently experiencing some pain problems. So basically what multimodal approach means is that there's multiple ways to, address someone's condition when it comes to pain. So there's definitely different ways. There's pharmacological ways, which means using medications to help treat the pain. There's non-pharmacological ways, such as getting physical therapy done, or going to get a massage, seeing a chiropractor. So basically non-pharmacological means just anything without medications. There's self-management techniques, basically motivating patients to do certain activities that kind of help with chronic pain. Yoga is a very common example. Just certain things that kind of help and, kind of keep your mind off the pain, and also helps you with your own treatment. So we use the term as self-management techniques. Interventional is when we get later down the road, such as, this requires surgery, or like, this requires certain types of interventions where we have to perform, physical procedures on the patient. So that's something that's usually way down the line once the first three options are no longer used, basically, or no longer working. So I'm going to spend a couple minutes here talking about what are pharmacological therapies. So the main ones that most of you have probably heard of are called opioids. Opioids are the strongest medications that we have when it comes to, dealing with pain management. Essentially, they work by, calming the brain, telling them like, okay, so the pain you're experiencing, it's back to what I said about the whole messaging system. What opioids are doing essentially is basically kind of telling your brain, okay, the pain's no longer there. So these drugs are working on the brain, the limbic system, the brainstem. Basically, it just gives you the most optimal in terms of pain relief. What it doesn't do is that it doesn't actually cure your pain. It's just basically telling yourself that, okay, you're not going to feel the pain. So that's one of the reasons why we try to avoid opioids, among many other reasons. I can go on a laundry list of things such as long-term adverse effects, overdose. You could die from taking these medications. They're that powerful. So this one that we usually wait until last resort. That's when we want to go to the opioids. The non-opioids ones, I'm sure everyone's heard of over-the-counter ones. That's your Advil, your ibuprofen, Tylenol, things you can go to your local CVS, Walgreens and get. There's certain other types of prescribed medications, anticonvulsants, antidepressants, certain ones that, it wasn't intended to help out with pain, but they've noticed that people who take these medications have experienced, some pain relief. And so we want to go, try these ones out first to see if it's one that works out, so that we don't have to jump everyone onto opioids and have to worry about managing that. I'm sure everyone knows this as well. Opioids are extremely addictive medications, and we'll go into that later in the webinar. But we definitely one that we want to try to avoid. Muscle relaxants is a common one. Topical medications, such as using Bengay. This basically just provides relief locally. So like if you have like a bruise or issue, it's better to use topical medications because they basically just stay in the area where you apply it. It's not a medication where you take by mouth where it goes all over the body. So topical is just a better alternative because it reduces your side effects greatly. And then before, this is, huge, if you're ever going to take anything with a doctor or pharmacist, just make sure you go over it with them. It's just important to keep them, in the loop of what you're taking. Even if they don't agree with it, it's better that they know that you're taking it than you doing it behind their back and, causing, problems and issues down the line because they just weren't aware that you were taking it. So doctors, pharmacists, we try to be as open-minded as possible, and we'll tell you how we feel about certain things. And even if you disagree, that's okay. That's totally fine, but just make sure you're as transparent as possible when it comes to healthcare. That's what you need to do to build a relationship to get better not just when it comes to pain, when it comes to all sorts of health conditions. Just be as transparent as possible so that at least we're aware of what you're doing. So when are opioids appropriate? So I'll give you a lot of reasons why we shouldn't use it, but they're there for a reason. So basically, when all the non-opioid treatment options were used, say you still don't have any pain relief, that's when we want to go ahead and, maybe try you on a low dose of an opioid because we want to give you pain relief. We're not telling you what to do. We want to treat you and make sure that you're back to normal. When pain is adversely affecting a patient's function, like I said, your lifestyle, your work, when things like that come into play, and the other ones weren't working, other options, then that's an appropriate time to use opioids. And when the potential benefits outweigh the potential harms. So I told you there's a lot of potential harms, but sometimes it is appropriate where you can, the pain relief just makes you feel better and back to normal, where you can, you appropriately use it. And also, when you are taking opioids, it's good to know it's just one option. I'm saying, back to that multimodal approach, it's just one way to help treat it. The best way to do it is to try all the different ways, the non-pharmacological ways, the self-guided management. Those are also important. So don't just think, oh, I just need an opioid and I'm done. What you need to look at it as, this is just one option, but I have a multitude of other options that I can utilize to kind of help out when it comes to pain management. So this is just a list of the, most of these are long-term opioid adverse effects. The main ones that I want to highlight are lungs. They basically can really cause shortness of breath if you're experiencing, for those taking, long-term opioids. If you notice any types of shortness of breath issues, make sure you report that to your doctor immediately, because those can be signs of, potential overdose. So it can cause, dizziness, which is the problem with the elderly patients. You don't want to feel dizzy because that can lead to falls, which can lead to, a lot of issues that we don't want to happen to you. It can affect your bones, it can affect your heart, your digestive system. All of these things are main concerns when it comes to long-term use of opioids, which is one of the reasons, just looking at this list, it's basically your entire body almost. We basically want to limit long-term use of opioids, and if you are on it, we want to try to get you down to the lowest dose possible where you're getting pain relief, but you're not, at risk for all of these issues that could happen with long-term adverse effects of opioids. So in terms of short-term effects of opioids, so, usually if you have the acute pain, they might give you like a 7-day supply, or like say you had surgery, and you're like, oh, you just need it for a week or so. So those are really good reasons to want to use opioids, because they provide pain relief for the short term while your body heals and goes back to normal, basically back to regular function. Long-term uses where, like I said earlier, that's when we run into a lot of problems. Tolerance is a big one. So we could probably put you on long-term opioid, but then say that your body will get used to it. And what happens with that is that your body will just be like, okay, this is no longer going to suffice when it comes to my pain management. Your body will be like, okay, we need a little bit stronger dose to get over the pain. So then we'll increase the dose, and then your body will get tolerant to that. And so basically it's just a long-term endless cycle of where your body will just adjust to it, to whatever dose you're on, and it will keep requiring higher and higher. And there just comes a point where there is no more higher dose of opioids, and you're just going to be in pain. Essentially, you're going to experience chronic pain. So that's one reason why we don't want to keep giving long-term use of opioids, is the tolerance factor. Dependence, as I said earlier, very highly addictive medication. There'll be times where I've talked to patients who are like, oh, I don't even have pain relief, but I just like the way it feels. And so that's definitely an issue. That's definitely one where that leads to overdose. So that's one reason why you want to be very, very careful when taking opioids. Risk of overdose, exactly. So CDC basically have different recommendations when it comes to prescribing opioids. So this is just something that doctors are aware of in terms of, certain caveats, certain things when it comes to prescribing opioids for patients. Main one is it's not first line. It's not the first thing you should be giving patients, because those are the ones that get addicted to it, are the ones that have never had experience with it, and they get like a medium to high dose of opioids that can be really damaging to the body. You want to make sure that you start extremely very low dose and then slowly work your way up, just so you don't have problems with tolerance, dependence, overdose, things that we established earlier. We want to also make sure that, what we're giving you is actually helping you out with the pain. We don't want to just give the medication and be like, oh, it's working, or are you using too high of a dose? Or, we just give it to you just to give it to you, just so that, you would stop complaining about chronic pain. Like, that's not the reason why we want to do it. We want to make sure that we treat the underlying cause, make sure that we find out what's going on, what's the reason why you're experiencing this. And that way we can go ahead and, basically prescribe you the right treatment goals. Risks and benefits are really important. Like I said earlier, it's, ask questions, make sure that you are comfortable with the medication, what it can cause. Like I said, long-term effects are very important. Make sure you know the side effects, even in the short term. Just be as knowledgeable as possible. That's the best thing you can do as a patient is, make sure you know what you're taking, know what it can do to your body. Because like I said, the more you know about it, the better your treatment goal will be established. Most of the stuff on steps 4 through 6 is essentially just how we do prescribing. We basically start low and go slow is basically the common phrase that we use. We don't want, like, the immediate release ones are the best ones for reducing chances of addiction, and basically because it just kind of just helps you out with the pain right away, and then it's done with it. It doesn't stay in your body too long. Don't want, like, just kind of repeating that, but don't use too high of a dose. We just want to make sure we get you the right amount. And when it comes to acute pain, make sure we're only prescribing it for a short period of time. So whether that's 3 days, 7 days, a week, 2 weeks, basically trying to make sure that we're not giving you unnecessary amounts of the medication, because that can lead to trouble as well. These are some things that the FDA kind of basically say in terms of using opioids safely. Basically, make sure you keep your doctor informed. They say if you're having to use the medication more often, because most of the time, some medications will be, take 3 to 4 times as needed. So make sure you let your doctor know, I only need to take it once. Or like, hey, I'm having to use it the maximum amount of times, which is, whatever was prescribed, like 4 times, for example, the 4 times a day, as needed, and you're taking it 4 times a day. Make sure you let your doctor know so that they're aware of it, and so that they know, how to tailor your treatment plan, basically, to make sure that you are getting the proper care. Follow directions carefully. Make sure you take just as prescribed. Don't take more than that, because the doctor is basically prescribing opioids as safely as possible for you. And then in order to reduce the risk of drug interactions, make sure you always bring your list of medications to your appointment so that they're aware of what you're taking, and make sure that we minimize the chances of drug interactions by, reviewing your current medication list, making sure that one or the other aren't going to affect you in a negative way. So basically, sometimes you'll be on a medium to high dose of an opioid medication, and you basically want to find out, like, okay, what can I do to kind of maybe lower this amount? And so there's multiple ways of how you would address this problem. And so one is where they keep increasing the dose and your pain isn't getting better, then there's no sense of being on a high dose of the medication, because, it's not doing its job. The job of taking opioid medication is to help you out with pain relief. So if they're increasing the dose and nothing's happening, what's the point of being on that medication? Side effects, if you're experiencing some adverse effects of the medications and that's also affecting your day-to-day lifestyle or your work, that's something you want to make sure you talk to your doctor about so that they are aware of this. And then they can maybe try a different type of opioid, or maybe try a different option when it comes to pain. The main ones for drug interactions are opioids and benzodiazepines. Those are the ones that are those are medications that are used for anxiety. So if you're taking any type of anxiety medication, make sure you notify your doctor before starting any opioids, because combination of both can lead to really bad adverse effects, like more, exponential adverse effects. It can lead to a higher risk of overdose. So you want to make sure that they're aware of this. Other health issues. So if you're having any other health conditions, your doctor, I'm sure, is aware of it. But if there's anything new that comes up, make sure you let them know, because if you have any of these conditions, being 65 or older, lung, kidney, liver disease, it just puts you at a little bit of a higher risk for adverse effects, just puts you at a higher risk for overdose. So just make sure that you're, being as transparent as possible with your doctor. If you feel like you are someone that, could potentially be, having misuse, if you have a prior history of, say, substance use disorder, if you have a prior history of, like, you just know yourself and you know that you have qualities that are addicting, this is definitely one where you want to make sure you let your doctor know, because this is one of the highest, most addictive medications that you could possibly take. So if you have any concerns, make sure you let your doctor know. And if you just want to get off of it, after this presentation, you're like, oh, wow, I just don't want to be on opioids anymore. Just make sure you tell your doctor, be as transparent as possible, express your concerns, ask as many questions as you can. That's the most important thing when it comes to your health and when it comes to pain management. It's just, let them know exactly how you feel, any concerns, any questions, always notify your doctor or pharmacist about them. So going into non-pharmacological therapies, we have quite a few options here. Those IT hot patches, basically, heat the area, make it cool again. Those seem to be working for certain types of pain. I think in the commercials, they always use for back pain. Relaxation, just taking, 10 minutes out of your day to just kind of lay down, to stretch, whatever helps you relax. Just spending a little bit of time every day doing that can help you out when it comes to chronic pain. Removing distractions, make sure you're not too stressed out. Acupuncture works for some. If you're interested in that, let your doctor know. Or if you've heard good things from friends and family, that's one way you can help out with when it comes to chronic pain. Exercising regularly, nothing too strenuous. Just make sure you're getting your regular 3 to 4 days of exercise a week. That can go a long way when it comes to chronic pain. Cognitive therapy, that's more of like training your mind. Like I said, pain, what it comes to it is it's just basically a messaging signal between your body and your brain. So if you can kind of find ways to, null the pain, you can do that with different types of cognitive therapy. Massage therapy is nice. Who doesn't like getting a massage? But that also helps out with when it comes to chronic pain. It's just a good non-pharmacological therapy. And just being mindful of, all these options and stuff like that can really go a long way. It can really help you out when it comes to chronic pain. Self-management programs, basically what they do is they address the physical, psychological, and social dimensions when it comes to pain. Like I said, the main thing is like your brain is the one that's kind of the receiving end of all these pain signals. And so we basically want to teach you how to cope with strategies to reduce pain, doing by changing behavioral, cognitive, and emotional pain responses. So this one is one where, we try to essentially get you to basically have different ways of coping it when you experience pain, do a certain type of exercise or do a certain type of activity to basically nullify that pain. And so this one, it can go really in depth of all the different ways. So I don't have time to go over all that. But that's something that if you're interested in, self-management programs are something that are really helpful. And, it's one way to avoid taking all those medications, one more medication. I'm sure you already have enough as is. So this is a good way to kind of help out when it comes to chronic pain. We do have, HealthNet does have a lot of programs available, and we'll discuss that later on. But there are some things or some programs that we offer which can help you out and make you, and have someone be in contact with you in terms of when it comes to self-management. Cognitive behavioral therapy. So essentially, cognitive behavioral therapy helps provide pain. What it does is it changes the way on how you view the pain. Basically, it kind of what we're trying to do is like remove all those thoughts, all those depressing ideas that you have about pain, because that what it can do is it can help change your mood. It can help basically tell you that, like, hey, the way you're experiencing the pain, here are some certain things when it comes to it, where you'll have at least a more positive outlook on it, rather than when you say, oh, I have pain, this is sad, and you just go down that, that snowball effect of what chronic pain can cause. So there's a lot of data on cognitive behavioral therapy that shows that it works, and including when it comes to treating chronic pain, substance use disorder, basically all the different types of mental health. Just having someone there to talk to is always good. It may not cure your condition, but like I said, it's better to help you cope with it, essentially, so it's not just kind of bottled up and you have no way to express it. It just gives you an outlet on, just for you to vent, just for you to basically have someone there to talk to about it, so that, maybe someone that's sharing the same experiences as you can make you feel a lot better about, your current condition. So this is just a good little alternative when it comes to pain management. Mindfulness, make sure you're paying attention more in the present. Meditation is one that really helps out. Like I mentioned earlier, yoga, just kind of being, in the now, instead of thinking about how much pain I was in, or how much, problems I was having in the past. You kind of just a different way of looking at it, so that you can be more optimistic about your future. Because if you have a positive outlook, positive mindset about, your health conditions, it usually tends to lead to better outcomes. It's one of those things where, sometimes it's just like the placebo effect. You take something that does nothing for you, but it makes you feel better. So that's one way of how we look at it when it comes to chronic pain, just trying to be positive, trying to have a good outlook. If you're always negative, if you always have a downwards look at things, that's one where, it's not going to help you out, even though you might be getting the proper treatment. It may be, you might just kind of be causing self-damage by, not being positive, or not being there, and making sure that, taking care of yourself is the most important part. Certain things that we kind of like to basically promote is something that kind of gets your mind off the pain. Is something that, things that you may enjoy that, require some level of thinking. This is just like a small list, but there are different things where you enjoy doing something, and it takes your mind off of what your pain, the pain that you're experiencing, because your mind's going to be focusing on, performing this activity. And that's one way of how we like to cope when it comes to pain management. Don't just sit around your house doing nothing, because then all you're going to think about is your pain. That's not one where you want to be at. So do whatever you enjoy in life, whatever, activities that you find entertaining. There's a whole laundry list of things you can do. Just try to, keep up with your hobbies, try to keep up with your daily activities as best as possible, because that goes a long way when it comes to your pain and pain management. Interventional approaches, those are the ones, like I said, that require physical intervention. So all these ones are, they're all basically different types of procedures your doctor may recommend. And this just comes with, they're all different. I can probably spend an hour on each one of these. But they're all different ways where, when pain medications and these non-pharmacological approaches aren't working, this is what we try to do, because essentially this helps treat the underlying cause. So that's why these are different types of approaches that you can talk to your doctor about, and saying hey, medications aren't working, let's go with this. Just going to spend a couple of minutes here on the Endocannabinoid System. So basically, this is the new generation of pain management that's been being basically promoted. So I'm sure you guys have seen on the news, CBD oil, cannabis, it's a different type of way of dealing with pain. And basically it has scientific backing on how it works. The only thing with that I have to, say is that, there's not too much data on it to suggest that it works. So, make sure you talk to your doctor, say hey, I don't want to take opioids. Let me try this out. And, they'll probably be okay, let's give it a go. So it's one of those things where it doesn't seem like it will hurt you, but, we're just still waiting for the data to show, that this can be something that is something that works for you, something that is, a good, safe alternative. So anytime you're interested in trying any type of pain management that's not, Western medicine, Most of the time, it's usually safe, but you won't make sure you always talk to your doctor first before you go into trying something on your own. Diet is really important. I'm not going to spend too much time on this because I'm not a nutritionist, but eating a healthy diet goes a long way in terms of chronic pain management. So making sure that you are eating a healthy, balanced meals, daily, 3 times a day, whatever your diet you prefer. It's obviously a hot topic, but most of them, if you stick to a diet, you will notice just positive outlooks. You'll feel better. Your body will feel better. So it's something that if you are really interested in, you could tell your doctor to refer you to like a nutritionist, and they'll go over your daily meal plans, stuff like that. It helps out a lot when it comes to not just pain management, but it comes to basically almost every disease out there. Diet is very important and really good for a health condition. Moving from patient to person. So basically, these are just kind of like a little stepwise function that they, professionals recommend. Essentially, there are different things to kind of get you in the right mindset in terms of, okay, so you do experience the pain. What can I do about it? So, make sure you get involved, set priorities, set goals. This pain, if you have chronic pain, it's not just going to go away overnight. So you have to be realistic. You have to basically train your brain and say like, okay, this is something I'm going to have to deal with. And once you accept that, then you can talk to your doctor about it, see what the different treatment options are. So basically, these are just like important steps to get your mind in the right place so that you can optimize your treatment when it comes to pain management. And these are just a list of the resources that I used when giving this whole this webinar. So if you're ever interested, make sure you just take a look at any of these websites. They basically will tell you all the information when it comes to chronic pain. And I believe that will conclude my portion of it. So I will hand the mic back to you, Kristen.
Yes, thank you so much, Niket. And I know you mentioned myStrength on one of your previous slides, and also discussed the importance of mindfulness, which brings us to this important resource that we have to offer our members, which is called myStrength. myStrength is an online program that is also available in app form to access through your smartphone so that you can have support at home or on the go. So what does myStrength do? myStrength helps to reduce stress, anxiety, depression, insomnia, substance abuse, and there's even programs on COVID-19, pregnancy and early pregnancy. It's just a really robust program that offers many different programs that are available. So it does have modules, quick videos from mental health professionals. There's guided meditations and inspirations on different topics such as joy, laughter, positivity, meditation, just to name a few. So it is free to HealthNet members. So please be sure to check it out when you log into healthnet.com. Next slide, please. We do have personalized support, which we call our health coaching program. So whether you're trying to become healthy or stay healthy, I really encourage our HealthNet members to contact our health coaching because it can be, quite the journey. So they'll help to understand what motivates you. You set specific goals, you track your progress just to help you stick with it and so that you can accomplish your journey at the very end. We also have our nurse advice line that can help answer any of your questions by calling this number on your screen. Next slide, please. Thank you. We have a ton of different wellness resources for our HealthNet members. And if you're not a HealthNet member, please contact your health plan to see what wellness resources are available to you. So you have access for your personal health record, your HRQ, which is your health risk questionnaire. Only takes about 15 to 20 minutes to complete. And it's great because at the end, you'll get a snapshot of your health status. And based on your responses, it'll prompt you into some of our telephonic and online programs that are available to you. So please check those out online as well at healthnet.com. Next slide, please. And we have healthy discounts. Who doesn't like a discount? We have discount to weight management programs such as Weight Watchers, Jenny Craig, chiropractic services. So we talked about that a little bit today in the presentation. We also have healthy discounts to eye care, hearing aids and screenings, and fitness clubs. So those are available to you at healthnet.com as well. Next slide, please. All right, so please mark your calendar for our September webinar, which will be on Wednesday, September 15th from 12 o'clock to 12:45. The topic will be beating the winter blues, cough, colds, and flu. So to help you prepare for the twists and turns of winter, this webinar will provide tips to help you stay healthy, even when the weather isn't so nice out. So we're going to explore how to start building a winter exercise routine. Even though we're in California, most of us, it does get a little bit colder, so we want to keep our exercise routine in place. We're going to prepare to beat the holiday blues that might affect some of us. So holidays will be here before we know it. So we'll focus on that a little bit. We'll touch on healthy eating strategies. And then lastly, ways to prevent, detect, and treat colds and flu. So please join us on September 15th. Next slide, please. All right, I would like to thank everybody for your time today, especially Niket. You did an awesome job. Thank you so much. This is such an important topic. And maybe some people on the call today, it might not pertain to, but I'm sure all of us know that someone close to us might be having the effects of that pain cycle that you described earlier in the presentation. It's such an important topic. So thank you again for your time. I hope everybody enjoys the rest of your afternoon. Thank you once again.